Hey everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care in Geneva, New York, coming to you today with a shoulder hack. So one of the most common problems that we see in the clinic is shoulder impingement. Shoulder impingement, we've discussed on other videos, is somewhat of a garbage term, but impingement is essentially where, as I elevate my arm upward, what happens if this is the glenohumeral joint, so here's the ball and socket, well, here's the ball and here's the socket, as the arm is coming up overhead, the rotator cuff, which is 4 distinct muscles that wrap around the head of the humerus, their main job is to depress the humeral head, so as the arm is elevating upward, that the tissues don't push excessively into what's called the subacromial shelf. So the problem is that this happens a lot. So it can be what we call primary impingements, where you might have something like a bone spur sticking down into the space, or it could be what's called a secondary impingement, which is a muscle imbalance. It could be a muscle imbalance. One muscle in the front's too strong, muscle in the back is too weak, or it could be a function of that the secondary restraints such as capsules or ligaments have become attenuated or stretched, and it allows for extra movement because we work out in front of our bodies. We don't do anything behind our bodies. So what we see here in the clinic, and again going through great clinical examination, which your physical therapist will do with you, we identify that, okay, this is, let's say, a secondary impingement syndrome. So again, if here's my shoulder blade, here's the ball, and my rotator cuff sits on top, is that it's pinching. So one of the things that we can do is we first want to test. We want to say, okay, what is the motion that is most affected, or what is a motion that is affected? So very often, if I raise my arm out to the side, I get to somewhere into this range, and I go, that hurts, and it hurts over the outside of my shoulder. So our litmus test would be, okay, I'm going to go to the first point of pain. I go to that pain, and I say, okay, that's my first point of pain. So I'm going to take that point, and what I want to do is I want to decompress it. So how can I decompress it? Well, the problem is that the ball is riding too high up into the socket. So if I'm just sitting, I don't know if you can see this here, I'm just going to grab the bottom of my chair here, and all I'm going to do is I'm gently going to lean. So as I lean, I'm going to feel a stretch coming through my neck. I'm going to feel maybe some weird sensation into my shoulder, all the way down into my arm. So I'm just leaning to the side. I'm separating those joint surfaces. So if you visualize what's happening, as I lean, I'm pulling things apart. I'm going to hold it for about 7 seconds. I have patients repeat it 7 times because that's just easy to remember. So we do it 7 times 7 seconds. We want to repeat our litmus test. And again, litmus test was out to the side. So let's say I started here. I do my 7 times 7 seconds. Now all of a sudden, I go here. Okay, so that clearly is a win. So I've been able to raise my arm further. Now, are the results going to stay? No. What does it really do? Does it stretch tissues? Look to the video on stretching. Again, maybe, maybe not. There's lots of literature looking at, can we stretch capsules and whatnot, which are supportive structures, and literature really says we don't. So more and more the theme is that maybe we're neuromodulating. So we're able to relax the nervous system, so it allows the rotator cuff to calm down, or the musculature around it to calm down, and allows the ball to sit more properly into the socket, so that when we go to bring it up, it's not impinging. So there's our shoulder hack for today. Make sure when you do this, you check your mobility before, and again, that's pain-free mobility, so don't go with, oh, it hurts a little bit. It should either be it hurts or it doesn't hurt. So pain-free mobility, that way I know, did it work? If you have any questions or comments, feel free to reach out to us through our website. You can go to our Facebook site at prescriptionfitnesspt.com. And I'm Josh.